stable 2% increase compared to last year. After the Spring Festival, with the change of the epidemic, and we are facing with the complicated situation, after the Spring Festival, we have a reduction of the population flow. We do see any peak of the post-Spring Festival travel. From January 25th to February the 14th, the total travelers is about 283 million, which has been reduced by 82% compared to last year. Today is February the 15th. February the 12th will be end of the post-Spring Festival travel. I would say there were not much changes for the population flow of the passengers during the travel. Considering the current situation, based on our analysis, for the 40 days Spring Festival travel, there will be a 45% decrease of the population flow. And for the other kinds of traffic, we'll see a big reduction as well. Especially for certain regions, the number of travelers is 0. And also, we will not see any peak in the post-Spring Festival travel. So on a daily basis, we will see fewer travelers, and also the span of the Spring Festival travel will be extended. That is to say, for the post-Spring Festival travel this year, there will be no peak, because in the past few years, we will see a peak. So at the peak time, it is around 50 million people, only accounts for 20% as of previous years. As for the types of the passengers, most are the students who are returning to schools and the migrant workers return to work. We have very few travelers for tourism. So by the end of February, most of the travelers are migrant workers who are returning to work. It will be estimated that the number of rural workers is around 300 million people. As of now, 80 million people have already returned to their posts. So meaning that after March, around 100 million people will return to their work. For the students, there will be around 100 million students returning to the schools. But this figure is subject to the opening of the schools. This year, even though we do not see a apparent peak of the post-Spring Festival travel, but we still have to ensure the safety of the passengers and the travelers. Going forward, we will follow the following 4 principles so as to work on the prevention and the control of the COVID-19. For the prevention and control, we will strengthen our efforts for disinfection of the transportation vehicles and also protect the frontline workers. So by doing that, we will cut the spread of the virus through the transportation virus. A relevant department should collect the information of the passengers to make sure that we can trace the traveling history of the travelers. And also we have to optimize our transportation capacity and invest more human resources to manage this situation. And we should strictly manage the occupancy rates of the transportation vehicles. We could also learn from the experiences from the Sichuan province. And we should step up efforts to reduce the risks of the cross-infection. We need to provide guidance to different cities to make sure that the transportation can be resumed in an orderly manner. At the same time, we should also work on a contingency plan, especially for the transportation arrangement during severe weathers. And we have to stay closely for the traveling of the passengers. According to the travel plans of the passengers, we should adjust our plans accordingly. Thank you. Now the floor is open for questions. Please identify yourself before you raise the question. CMG CCTV. As Mr. Liu just give us some introduction that there's no peak on the post-Spring Festival travel, but still we may foresee some concentrated returning of the workers. So can you tell us more about the return travel from the workers? So we have 3 days to go to the end of the post-Spring Festival travel. As I have just said, because of the epidemic situation, this year we will not see a peak of the post-Spring Festival travel, and the data also supports us. Start from the first day of the Chinese New Year until yesterday, so in total, we have 283 million travelers. So for the daily average, it's around 13.4 million. So some of these people are returning their work positions from their hometown, and also most of them are actually the migrant workers returning to work. And this figure has been dropped by 38% year over year. So in February, most of the returnees are migrant workers. And we have very few travelers for tourism. Even though if we look at the figures, we could see this is fewer than previous years. And also I have just said the span of the Spring Festival travel will be extended. However, the peak time will only account for 20% or 30% compared to previous years. So there is an estimation that from February the 19th to the end of this month, the daily passengers is around like 14 million per day, which accounts for only 20% as compared to last year. And also the central government also sent out a notification for off-peak travel guidance. So we have a very good synergy between different departments to make sure that the passengers can return their home or return to their workplace in an orderly manner. After March, there may be some students, travelers who are returning to their schools, as well as some migrant workers returning to their work. And we are foreseeing 100 million students returning to schools. And according to the highway network, the figure also in line with our prediction. Since February the 9th, the daily traffic of the highway is about 59.9 million vehicles. A 8.1% decrease compared to last year. That is to say, the number of traffic on the highway is less than 75% compared to previous year. So we do not expect to see big traffic in the highway, even though we may see a peak, but this kind of peak is only like 20% compared to previous years. Any comments to add? Mr. Li. Due to the outbreak of the epidemic, we also see a big decrease of travelers who are taking the aviation aircraft. The daily travelers is only 470,000 passengers, accounts for 1/4 of that is last year. Start from January the 21st the Civil Aviation Administration issued a policy to offer a free refund to the passengers. As of now, aircrafts in China and overseas has already handled over 20 million refunds and returns. And the daily expectation is less than 200,000 people per day. So the number of passengers accounts for only like 1/10 of that is previous years, and the occupancy rate is only 40%. In the upcoming days, we have several expectations. First of all, the civil aviation will not expect a peak hour, a peak time for the post-Spring Festival travel. As of now, we have adequate capacity to meet the needs of the passengers. Second, for the passenger flow of the post-Spring Festival travel, before the Spring Festival, most of people are traveling out of Beijing, Shanghai, and Guangzhou, and we will not see a duplicated travels during this period. And as I just said, we have 40% refund and return. Because of this epidemic, many people will cancel their trips to visit their families, their friends. With the evolution of the epidemic situation, the government and the enterprises already asked some people to return earlier, which also alleviate the pressure for the post-Spring Festival travel. And going next, we may expect some student passengers and the migrant workers to return to their schools and work. As of now, we also offer some policies to the students. We encourage them to have a later travel, but that's subject to the opening time of the schools. The CPC Central Committee and the State Council have issued a notification for the off-peak travel guideline. They have taken a series of effective measures. We have already seen some progress on that. Previously, we are expected that on a daily basis, we have around 11 million people per day. However, for the actual situation, in total, we have less than 184,000 passengers per day, which has a 83% decrease. So for 14 days, the number of travelers is less than 1 million people per day. And also we have over 100 million tickets refunded or returned. So in the near future, we will not see any peak for the post-Spring Festival travel. After the Spring Festival, I would see 5 characteristics. First, we may see some people for business travel, tourism, family visits, migrant workers, and students. But we have seen that the business travelers and the tourism travelers has a big increase. And most of the people who intended to visit family members already returned to their hometown. And for the schools, many provinces and cities has announced that the school will not open until the end of February. So we will not see a big increase of the number of student passengers. And we are also launching the measures to encourage the off-peak travel. So we will not see a surge of the number of students and the migrant workers. So in the future, maybe we have some migrant workers returning to their work in March. We're expecting that after the Spring Festival, around 56 million people will return to their job. Around 20 million people already returned to work, and 27 million people are still waiting to go back to their work position. And also we analyzed the data for the tickets selling. The daily peak is less than 1 million tickets. If we compare this figure to last year, it only accounts for 10%. That means that for the railway transportation, we will not see a peak in the post-Spring Festival travel. For the transportation, for the post-Spring Festival travel, we also made several arrangements. First, we will scientifically arrange the traffic capacity. We will not sell tickets without seats, and also we will sell tickets to the passengers so that these people will not sit in the same row. So the maximum capacity for us per day is around 8 million per day. And based on our newly released policies, so each day the maximum capacity is that we will sell 4 million tickets per day. So as I have just said, the estimate is around 1 million tickets per day. So I think we can ensure we can meet the needs of the travelers who are returning to work. I have two questions. My question is that before you take on the aircraft and the train, you have very good physical condition. However, when you get on board, you start to develop some symptoms. What measures we will take to manage this situation, and what kind of disinfection measures do you take to clean and sterilize the carriage and aircraft? Thank you. For the railway corporation, we have set up a scientific way to deal with those passengers with fever. Each one of the train would reserve several rows at the isolated area. On the train, if we find some people with fever, and our working staff will quarantine these people immediately. And we will follow the pre-existing instructions and regulations. And later on, we will transfer these people to quarantined areas locally. For people with fever, we will restrict these people's movement and also disinfect the train. With screening, if we found some confirmed cases of NCP, we will report to the local government on the situation and also provide information on the close contacts so we can better trace the travel history of these people. Even though the work resumption will not bring a peak of the post-Spring Festival travel, however, with the new development of the epidemic situation, we will continue to improve our measures. First of all, we will monitor the travel information, and we will provide conveniences for passengers to order tickets for the aircraft. If we found the occupancy rate is high, then we will change the size of the aircraft. And we have to put equal emphasis on prevention as well as control. For the enter and exit of the airport, we will have a screen test of all the passengers. If we find someone max temperature is too high, then we will transfer these people to quarantine areas. In each sections, we will have our staff to check the body temperature of the passengers. We want to make sure that we can cut off the spread of the virus so that these people will not bring virus on the aircraft. And we will continue to ensure ventilation of the aircraft and also ensure the ventilation of the lobby, waiting room, and other areas of the airports. At the same time, we also need to sterilize and disinfect the public areas, and also we have to change the filter of the cabin of the aircraft. Within the cabin, we also set up a isolation areas to make sure that the virus cannot be spread inside of the cabin and the airport. If we find someone who are with fever, we also have a technical guidance. The cabin crew members had already received the professional training. If they found this patient with fever, they will cope with this situation in accordance with the rules and regulations. So after the flight operation, our working staff will do an overall disinfection to the aircraft, including the seats and the cabin. And also, we develop a new type of sanitizer in the aircraft. And this kind of sanitizer is specially made for aircraft. So this technical guidance is available in English as well. So the overseas aircraft and the air companies can also refer to this technical guideline. Thank you for your question. When we are taking the trains and the flights, there may be some people with fever or develop some symptoms of the NCP. First of all, we would like to isolate these suspected patients. And another step is that we have to register all the close contacts of those patients. If we do not register those people 2 or 3 days later, these people may be infected as well. So we have to keep track of those close contacts. We have to give more information to those close contacts so that they know what to do after they leave the aircraft and the trains. The NHC, the fourth version of the Prevention and Control Guideline, also give a definition on close contacts. If people who are riding with suspected patients in the train or the aircraft, these people will be considered as the close contacts. And these people have to register. So if they have any contact with those patients, these people, first of all, they need to have a self-quarantine and isolation. And if they develop some symptoms, they have to seek medical advices. And for the disinfection and the sterilization, NHC also published a guideline to offer instructions. It is quite detailed to instruct the civil aviation and the China Railway for the disinfection. With Shenzhen satellite, with the work resumption, many people will take public transportation. So this may inevitably cause close contact. So what can we do to prevent this situation? Mr. He. You've just mentioned that during the post-Spring Festival
As you said,
people may take
as
rail
workers return to work,
铁路、公路或者民航返回各自的学校，
they may
返回各自的工作岗位。
return to
那
their
么在这个时
post
候呢，当你要做出这种
or
决定的
students
时
return
候，
to
首先
schools
要对自己的健康状况进行判
using
断。你之前
railway,
是不是
highway
感
or
冒发
civil
烧了？你这
aviation
状况
services.
有没有这
Or
种健
before
康上的不允许？
you
那
take
么
any
健康状况
trips, you need to check if your health condition permits such trips. We suggest you wear face mask and practice personal hygiene. For example, if you cough, cover your mouth and nose. Don't spit anywhere you want. This is highly inappropriate. And on board passenger vehicles, when you find other passengers cough, please follow the instructions of the crew members in registration of certain information, as I just elaborated. Or take other precautionary measures as required. This is for your own health and others' protection. If you don't provide thorough information, it will be difficult to trace your travel history, and this is highly irresponsible for yourself and your fellow passengers. And as for the crew members, they need to put face masks. This is a must, not just for themselves, but also for the passengers. Surgical masks can do the trick. You don't have to wear the N95 masks, and put on the gloves and practice disinfection of the vehicles. If you find some pollutants on board the vehicles, you need to clean the spittles and other pollutants as quickly as possible to prevent the spread of the virus on board the vehicles. Well, let me add a few points. Just now, Director General He made very clear how to protect yourselves and protect your fellow passengers. The Transport Ministry follows the instructions of General Secretary Xi Jinping on science-based and targeted measures in outbreak response. We work together with Human Resources and Social Security, Health, Public Security, and Railway and Civil Aviation departments to make coordinated interagency efforts to ensure the effective transport services and effective control of the outbreak. Well, altogether, there are 6 points. First, we will ensure disinfection, ventilation, cleaning of transport vehicles and stations, and to take temperature screening of passengers. Second, we will strictly control occupancy rates of passenger vehicles. The coaches, ferries, and special coaches for migrant workers. The occupancy rate will be no more than 50%, and passengers will be seated with distance and seats between them, and appropriate space will be reserved for medical observation on board conveyances. Third, we will ensure registration and tracing of passenger information, and we will collect ID information and contact phone numbers of the highway and waterway passengers, and such information will be submitted to health departments. On the big data cloud platform of integrated transport, we have uploaded the information registry system, and the service providers will use such a system for free. Fourth, we have carried out special coaches for migrant workers On February 7th, we issued notice to promote the experience and best practices in Sichuan and to provide door-to-door services for migrant workers' travels. And we also practice toll-free access and green channels for such trips. We have ensured well-organized trips, health monitoring, smooth transportation, and coordinated delivery. And over 10 provinces, including Sichuan, Shandong, Fujian, and Zhejiang, have organized such door-to-door transport services for migrant workers. As of yesterday, a total of 26,000 migrant workers have returned to their posts with such services. Fifth, we have stepped up precautions and protection of frontline workers, providing transport services to prevent cross-transmission. Now, the post-Spring Festival travel season is still going on, and the task to contain the outbreak is daunting. We will work with relevant departments and localities to enhance coordination and step up protection measures to ensure effective and health transport services. Well, thank you for your question. As for CAAC, we will control the total passenger flows. And second, we have the whole process temperature screening, including checking, boarding, and onboard the aircraft. And for all the passenger channels, we check and change the air filters frequently to keep the air clean. For the crew members, we have also stepped up protection and precautions. Onboard aircraft, medical observation areas are reserved, and passengers with fever symptoms will be seated in such areas. And after passengers disembark, such areas will be disinfected, and there are detailed guidance and procedures for these practices. The CAAC will continue to make science-based, dedicated, and calm response and continue to ensure effective control of the outbreak. Thank you. As for the railway system, in light of our conditions, we have taken a host of measures to ensure outbreak containment. En route, the return trips, we first work hard to minimize concentration of passengers in ticket booking, entry and exit of stations and onboard vehicles. We minimize the possibility of passenger concentrations. And second, we have stepped up the screening of passengers with fever and emergency handling. Altogether, such 596 passengers with fever symptoms have been properly handled. And third, we have enhanced ventilation, disinfection, cleaning of stations and trains. And fourth, we have strengthened health protection of railway staff. This is done out of responsibility for the staff themselves and the passengers. All of them will get their temperatures taken before and after their missions. And for those temperature above 37.3 Celsius degrees, they will not work and they will see the doctors. And I urge all the passengers to better protect themselves and work together to fight the epidemic.
From Japan. Yesterday, Beijing municipal government announced that all persons returning to Beijing must conduct a home-based observation for 14 days. There are travelers who have returned to Beijing from Japan. So this announcement by Beijing government, does it include all persons who have returned to Beijing from overseas? Mr. He, please. I have noted this announcement. So all persons coming back to Beijing must stay home for observation for 14 days. This policy is introduced by the Beijing government in light of the epidemic control work. Doesn't specify which area the person is from. For the purpose of containing the virus, Beijing government has its own considerations in introducing this policy. Hong Kong China Review. There is media reports that say that the epidemic control is not at a crucial stage, and the return travel will bring concentrated persons. So how do we reduce the transmission of the virus through public transport and lower the risk for some regions? As for how to stop the transmission of the virus through public transport vehicles, there are two aspects. First, as passengers, there are a few things you need to do because the vehicles are just vehicles. The passengers must be very cautious. We prohibit any person with fever, coughing, or other symptoms to take public transport to work or to other places. It is strictly prohibited. Once the person is recovered and you meet the certain criteria, you can go and travel. And for those carriers of those public transport, railway, civil aviation, and other systems, there are many instructions and requirements for them. And also there are requirements for road traffic, for road transport, and these requirements must be followed through to limit the transmission of the virus through public transport. For the benefit of time, the last question, please.
With the Economic Daily. My question is for CAAC Vice Administrator Li Jian. Some media reports say that the supplies in China in outbreak response are still lacking, and the problem of delivery of emergency supplies and personnel to front lines is still a problem, especially to key regions like Hubei. And could you elaborate on the work of the CAAC departments and what is the priority for emergency transport going forward? Thank you for your question. Since the outbreak started, CAAC resolutely implements the instructions of the CPC Central Committee and State Council and follow the guidance of the State Council Interagency Task Force from January 24th to February 14th. CAAC altogether organized 241 shipment missions carried out by 21 airliners, sending 29,364 personnel. And among such missions, we conducted 181 missions for medical teams and 9 chartered flights, taking back 1,185 Hubei tourists from overseas. And we carried out 48 chartered flights for the shipment of emergency materials. During these missions, CAAC systems swiftly risen to the call and overcame the urgent and heavy challenges with a strong sense of responsibility and united efforts. Notably, in less than 1 hour's time, we completed the task of delivering the 20,000 protective goggles as required by Premier Li Keqiang, and the heaviest mission were concentrated within 2 days, with 50 chartered flights to send 600 and 288 medical workers to Wuhan. And the furthest mission is a chartered flight to take 53.6 tons of materials from Durban, South Africa, back to China. Going forward, we will encourage more airliners to participate in the outbreak response transport missions and to mobilize more resources to ensure unimpeded air transport in support of Hubei's outbreak response. At the same time, we will ensure that all the frontline crew members are healthy and well protected. Moreover, we have noted the importance of aircraft in carrying out response measures as they are more flexible, convenient, and fast. That's why they are an important force in emergency rescue. And now the outbreak response is at a most demanding stage, and faced with the demanding needs, with high frequency and door-to-door needs, we will do everything possible in disinfection and other tasks. Recently, CAAC has made emergency arrangements to mobilize nationwide resources to take up such social responsibilities. And second, we have opened green channels for airliners to participate in the outbreak response. And we have expedited approval procedures and improved the settlement methods in fueling and preferential policies in the fuel charges. In a word, we have poured resources from various sides to let civil aviation play a better role in the outbreak response. As of yesterday, nationwide, a total of 123 airliners used 608 aircraft to take 4,898 missions with 1,308 flight hours. Such missions include the shipment of medical supplies and spray disinfection, including the 27 airliners from Hubei who used 53 aircraft for 213 flights for 201 flight hours, and a total of 53 tons of shipment of medical materials were made. Thank you. That's all for today's press conference.